Hi, friends. It's Saturday, March 21st, and about a week after our first video about this, um, thought I'd give you an update on where we are with the COVID-19 outbreak here in New Orleans, the greater New Orleans area. So as of today, there have been 352 cases identified so far in Orleans Parish with 12 deaths. And in Jefferson Parish, an additional 116 cases and 2 additional deaths. So overall, in the two parish area, there have been 468 cases and a total of 14 deaths so far. And the epidemic is really spreading now throughout the state, particularly in the river parishes and along the interstates to the other metropolitan areas, Baton Rouge, Lafayette, Alexandria, and Shreveport-Bossier all have cases now. And today, there was a death in a 30-some-year-old in Catahoula Parish. So it really appears that the virus is now circulating pretty widely throughout the state. Let me put our outbreak here in the New Orleans area into perspective for you nationally. All of you are aware, I'm sure, of the outbreak in the assisted living center in Seattle, King County, Washington, and the ongoing outbreak in that community. And you've heard a lot in the national news in the last few days about the rapidly increasing number of cases in New York, and in particular New York City, and the concerns about healthcare establishment being able to keep up and so forth there, as well as the greater and greater restrictions being placed on people's movements. Basically, folks in New York are now largely being asked to do what we here in New Orleans were asked to do about a week ago. So far, the death rate on a population basis here in New Orleans is essentially equal to that in Seattle, King County, Washington, which is the highest in the country, and considerably above the death rate per 100,000 in New York City, New York State. I tell you this not to alarm you or increase your anxiety level, but rather to say that the advice we've been given by our governor, our mayor, has been right on, and it was timely. And it's important to stay the course, to continue to practice good social isolation, largely staying at home. If you can limit your exposures really to the people inside your household, and so far you're feeling well, you're now 7 to 10 days out from your last potential exposures, and that means you're past the average incubation period and closing in on the outer limits of it. So the average incubation period is 5 to 10 days, and overall it could be as early as 2 and as long as 14 days possibly. So stay the course. Continue to practice good social isolation, doing video chats and phone calls and working from home, going to school from home, and all of those good things. And you're in good shape at this point if you've been doing that, and you will remain safe if you continue to do that. So let's talk a little bit about testing. That's been an issue here in our community. We've not had access to adequate testing, frankly, and it's not the fault of anybody locally or in the state. It's really on the federal government for not having been adequately prepared, and to some extent on commercial labs that have gotten really backed up, and their processing time is incredibly delayed. So what that means is that we've had a significant limitation in access to testing, and that's in the process of changing. So as of tomorrow, the city will be opening 3 drive-through testing facilities, the first in the nation with federal support. So one will be in the parking lot at the Mahalia Jackson Theater, one at the UNO Lakefront Arena, and one in Westwego at the Ilario Center. The first two have the capacity to test 100 people a day, and the Ilario Center 200. They're going to be open from 8 to 6, and they'll be drive-through only. You won't be able to walk up, and that's to protect the people there doing the work. So you can drive up. They ask that you have ID and your insurance information with you. I believe they're likely to charge your insurance, but I think the test will be free to you. And if you don't have insurance, you can still get tested at no charge, is my understanding. Now, you can only be tested, however, in these facilities if you have some symptoms of COVID-19 disease and or have had exposure to somebody who's known to be infected. So I believe in these sites, if you have a temperature of 99.6 degrees, which frankly isn't really a fever, or other symptoms like cough or shortness of breath, or again, exposure to somebody with known disease, then you would be eligible for testing. The other places in the community where you can be tested include a number of sites at Auctioner. They have testing specific sites at their urgent care facility in Mid-City on Canal Street, and in Mandeville at their urgent care center there. Auctioner also has been doing about 400 tests a day through commercial labs, but they have had a significant delay in getting results back. It's taken 5 to 8 days for results to come back, and my understanding is that as of Monday, they will be able to do on-site tests and turn around the test results within 24 hours, and will also increase their capacity to about 800 tests a day. So that's an important thing. They do require, however, again, that you have symptoms of COVID-19 disease, a temp of 100.4 degrees or higher, cough, shortness of breath, and or exposure to somebody with known disease. Now, LCMC system, which includes UMC, Toro, New Orleans East, and West Jeff hospitals, as well as Children's Hospital, have a telephone number you can call for screening for possible testing and symptoms. And that number is 504-962-6206. They are available for your calls from 8 to 11, 8 a.m. to 11 p.m., Monday to Friday, and on Saturday and Sunday from 8 to 8. So testing is going to be increasing, and as that happens, we can expect to see a spike in the number of recognized cases. Now, I want to caution you not to panic about that, because what that means is not that there's more transmission going on, but rather that we're simply able now to recognize a high proportion of the folks who are actually infected. And also, as the rapidity of getting test results comes back or increases, that we'll see a spike from that as well. And then we'll see a little leveling off, and then likely continue to increase for a while. However, since we have been, I think, as a city, largely following the guidance of our leadership and really socially isolating now for a week or better, I think we'll start to see in another couple of weeks some leveling off in the number of new cases reported. And if we stay the course and really continue to isolate and follow the guidance, we should be in good shape, certainly individually. And I think our city has a reasonable chance of bringing this epidemic under control. Will we then be able to go back to work and go back to school quickly? I think it's likely we'll have to stay the course for a number of additional weeks. And at this point, I think it'll be at least 12 weeks. And the reason for that is even if we get our local epidemic under control, if things are still raging around us in other parts of the country, um, we will have to continue to be isolating ourselves and social distancing and so forth. So all of those things are just now part of life. Um, a word about how you go out safely if you must go out. And of course, the first thing is don't go out and about other than to walk around outside and get some exercise. And by the way, I've heard some concerns that you might be able to catch COVID-19 because somebody with the infection just walked by um, and you walked through that same air. The chances of that, I think, are really infinitesimal. This disease is almost certainly transmitted through the droplet mode, meaning that the way people get infected is by having somebody who have the virus actively infecting their body, cough or sneeze on them pretty directly. Um, the virus really isn't going to persist in the air for very long. The droplets will fall out of the air for one thing, but also if you're outside and there's a little breeze blowing and a lot of air around you, the chances of you getting infected are really, 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 really remote. So don't let that keep you from going out. Now, keep your distance um, and socialize with your neighbors and friends. We've been sitting on the porch talking with our neighbors as they walk by. Yesterday evening, I spent a while standing outside chatting with a number of neighbors, and we all kind of stayed our distance from each other, but we had some really lovely conversations and were able to catch up. So I encourage you to do that as well as to stay in touch with people on the phone and so forth. If you have to go to the drugstore or to the bank or make groceries, as we all have to do from time to time, how do you do that safely? So, first of all, if you can do your banking online, do it that way. If you have to go and get some cash, go to the ATM and make sure there's nobody else standing nearby when you go up, or go through the drive-through. All of those are safer than going inside. Um, Making groceries, going to the drugstore. Many of the drugstores are delivering certainly medications, but there are a number of grocery stores that you can order online and have food delivered or drive up and pick it up. I believe Whole Foods, if you're a Prime member, you can order online, although I think their delivery is somewhat backed up at this time. I think both Fresh Market and Langenstein's, you can order online and drive up and have the groceries brought out to your car. For most of the other grocery stores in town, what I've found in my own search is that there are two main um, organizations that'll do your shopping for you. One is Instacart, and the other is Shipt. And they cover some of the same stores, but there are some differences in the stores they cover. I think one of them covers CVS pharmacies as well, so you could probably have them pick up things that are not just medications for you at those stores. Um, they both charge for their service. There's, I believe, a $99 annual membership in each, and then free delivery for orders $35 and more for the most part. I think with Shipt, there's sometimes an upcharge or an additional charge if it's at a busy time, which may be all the time right now in our community. And both of them also, I think, have per delivery charges without a membership, and probably a monthly membership that's somewhere in between. Um, One interesting difference between them is that Instacart will shop for you at Costco or Sam's Club, and you don't have to have a membership in either of those for them to get your groceries and other things there. I think one of them also picks up at an office supply store. So there are a variety of options out there. Check it out, see what the options are and what works best for you. And if none of that works for you, reach out to somebody that you know who's going out anyway to make their groceries, and ask them if they'll pick some things up for you, and then limit your contact when they bring them by. So again, stay healthy. If you've been doing all the things that have been recommended to date, you're in good shape. Just stay the course, and um, don't panic. Still not time for panic, just time to take it seriously and to do the things we've been asked to do. And when we do, we can be assured that we remain safe, and so do the people that we care about. So reach out to them by video chats, by phone, across the fence, and in the meantime, stay well, stay safe.